first of all, what prompted you to write this?
So I've spent a long time working in a whole range of different spheres related to the brain. How to treat newborn brain injury, how to treat and maybe even prevent certain traumatic brain injuries and concussions, looking at what affects long-term cognitive decline and dementia, as well as working with elite professional athletes, particularly Formula One drivers, trying to help them, stay on top of their game for as long as possible. And I saw across all those different areas, there are these core things that the brain seems to thrive on that are required either for development or maintenance of cognitive function. And these are things that people can apply to themselves on a day-to-day basis, improve their focus and well-being now. And then long-term, that translates to a lower risk of dementia.
So is dementia is it a genetic thing, or is it a function of atrophy? Is it a combination of those things?
It's a combination of those things. Certainly there's a genetic component. So maybe I will zoom out to start with and just think about what is dementia? Dementia is the clinical diagnosis of losing so much cognitive function that you're not able to take care of yourself on a day-to-day basis. There are several different types of dementia. The most common is Alzheimer's disease. That's something like 60 to 80% of cases of dementia. The next most common is vascular dementia, something like 10 to 20%. And then there are others like frontotemporal dementia, Lewy body dementia you get with Parkinson's disease. But those first two, something like 70 to 90% of dementias, they are directly tied to lifestyle and the environment. And right now, it's estimated that somewhere between 45 and maybe even 70 or more % of dementias are preventable. And most of those fall into those two categories.